part of a series of videos on artificial intelligence in health professions education by Prof. Munir Gohar Babar. As artificial intelligence tools integrate into clinical dentistry, students face a specific, dangerous vulnerability: automation bias. When a machine produces a confident, well-formatted output, the human impulse is to blindly accept it without independent verification. To counter this, we use the AI-Wrong OSCE station. This is a clinical simulation where a traditional patient encounter is bundled with a deliberately flawed AI-generated document, like a patient note or a radiograph reading. Baseline clinical exams evaluate whether a student knows the right answer. Today, that is no longer enough. To ensure safe practice, an institution must actively test a student's cognitive friction. We have to measure their willingness to override a machine's authority when the data points elsewhere. Designing the station requires a specific blueprint. Step 1 is selecting a high-stakes clinical scenario where an uncorrected AI error will result in measurable patient harm. These scenarios demand active critical thinking. You might test a student on overlapping periodontal disease with early caries, a medically complex history involving bisphosphonates, or a complex endodontic treatment plan. Step 2 requires inputting your chosen clinical parameters into a generative AI tool. The goal here is to output a standard baseline clinical summary or treatment plan directly from the model. Examiners must start with an authentic AI-generated baseline rather than writing the errors from scratch. Generating the text through an actual large language model ensures the document possesses the precise grammatical fluency and formatting that students will encounter in real clinical software. To overcome the fluency illusion, we seed subtle, confident errors demanding critical analysis. These include clinical hallucinations, inventing absent symptoms, internal inconsistencies, contradicting the chart, misskilling traps, defaulting to aggressive treatments, and dangerous omissions, failing to recommend critical actions like biopsy referrals. Step 4 is defining the new rubric. A traditional checklist might mark a diagnosis as correct, but it ignores whether the student actually detected the AI's error or simply followed a flawed machine lead to the right conclusion. To capture true clinical judgment, you need 4 specialized domains: critical appraisal, evidence verification, safe override, and documentation. Pause and ask yourself, how would you grade a student who successfully identifies and corrects the AI's clinical error, but completely fails to document their use of AI assistance in the final patient record? In Step 5, administration, the examiner's physical observation becomes critical. Watch the student's gaze and behavior. Are they actively cross-referencing the AI printout against the physical radiographs and the standardized patient in the chair? The grading logic has to shift. Examiners are no longer scoring just the final clinical answer. They are scoring the transparent, documented process of defying an authoritative machine. Step 6 is the post-station debrief. Using the DEFT AI framework, examiners force the student to articulate exactly what their diagnostic hypothesis was before they ever read the AI's note. This is where the core learning happens. You confront the student with their own cognitive reliance on the AI's fluent tone. You discuss the exact clinical harm that would have occurred, like extracting the wrong tooth, if they had not independently verified the data. The ultimate pedagogical principle students must take away from this station is simple: verify, then trust. We summarize this methodology with a 3-point behavioral sequence every student must adopt: question the source, verify against evidence, and override when necessary. By integrating AI-Wrong stations, dental institutions equip students to move beyond mere software compliance. These simulations produce resilient, independent clinicians who utilize technology to augment their expertise, ensuring patient safety remains insulated from algorithmic failure.